Hi, all. Thanks so much for joining us for Speaking of Making Healthcare Work for You. I'm Stephanie Fields, and I'm joined by my co-host, Dr. Apurv Gupta. And today we are talking about the interview that we did with Thomas Horton, who is a senior consultant at Informed Consulting. And the focus of that interview was all about telehealth and how it's increasing, and especially how it's increased during coronavirus. It was a really cool conversation because Thomas talked about some of the challenges that companies that are focusing on telehealth have thought about, from security to privacy to how they're maintaining the connection and the consistency with the patients that they're serving. And so it was really interesting to just hear it from all the different perspectives, how employers are thinking about it, who's using telehealth, how telehealth has grown over time. It was a cool conversation. Apurv, what were your thoughts on it?
Yeah, I loved it as well, Stephanie. I thought it was a great range of different ideas that informed consulting is having to think about, and Thomas did a great job of covering the gamut. Telehealth could be used for urgent care. It can be used for virtual primary care, which seems to be where he thinks a lot of interest is going to be right now. And also, he started talking about specialty care. So, in fact, it might even remake the way we think about how we get our care. Because instead of having to go in, obviously, it's so much easier to sit at home in the privacy of your home, accessible, affordable, more convenient. And now you can certainly get access to a specialist probably anywhere in the world. How is this going to remake our whole healthcare system? So a lot of questions, maybe not as many answers, but I think it certainly opens up, a very promising future for telehealth.
Yeah, it definitely doesn't seem like it's going anywhere anytime soon.
Right.
Have you used telehealth before?
I haven't, and it's interesting because I went in to see my doctor for a regular visit, and it was just a chat. It was just an annual visit, and during the visit itself, she started saying, I probably should have just scheduled this over telehealth. I'm not sure why I didn't do that before. Maybe I just didn't think about it. So it's kind of like it. Maybe I slipped through the routine because I'm sure once this gets more formalized, I'm probably the kind of person that they'll probably want to catch and say, hey, why don't we just do a telehealth visit? That could have been a good opportunity. There was another opportunity I had maybe a few months back, but I was more worried about having something seen in person. So I didn't think that telehealth would work. How about you? Have you used it?
I have, but only for primary care. I had an appointment with my doctor, and it actually was for a weight follow-up. So I
Oh,
was pretty excited whenever she said, let's
yes.
telehealth, because then I thought, oh, good, I don't have to worry about how many pounds her scale is adding. But thankfully I did meet my goal that time. Since then,
Excellent.
hashtag COVID. But yeah, so we used it for that. And it was really neat because I was just so glad to be able to see my doctor. And it was cool because you stayed on time. You didn't have to worry about waiting in a waiting room and who's coughing on you and are they wearing their
Mhm.
mask the right way. I just sat at my house, and then whenever it was time to dial in, I, clicked on the link, and then there was my doctor, and it was really great. And we had a
Wow.
same conversation. There was no difference in the relationship. And then the other times that I have not used telehealth, but I've thought about it, were there was one time my blood pressure was ridiculous randomly, and it's usually very, very on point. And it was a weird hour of the night, and you're like, I don't think I should go to the doctor for this right now. Like, this isn't an emergency room thing. But then I was like, well, wait a second, we have the telehealth app on this, so maybe we should call. And ultimately we didn't. But there were a few times like that over the last
Mhm.
2 or 3 years that I've always had it there. So I kind of feel like it's a safe thing in my pocket that, like, all right, if I need an answer right now, I would prefer to be able to go to a telehealth visit 24/7 and talk to a doctor. There's a peace of mind that you could just contact a doctor and have a video visit right then. And you
Yes.
look them in the eye and be like, do I need to go to the emergency room?
Right. That's true. There is eye to eye. They may not be touching hands on you, but there is eye to eye contact, and there may be a lot to say for that. There's the face to face contact, and they can still do a lot of other assessments depending on the devices they can hook up to the machine. So I think you're right, and it sounds like you've become a telehealth believer.
I am. I would say that I am. I would definitely not have hesitancy. There are some things that when they say they can treat them on there. I think, really, how are you gonna check that part of that body? Because I don't know how this is gonna go. But
Yes.
overall, yes, I would say I'm a big supporter and believer of telehealth.
Tremendous. Well, there's a big future ahead, and I have a feeling we're going to be doing a few more episodes on telehealth.
Absolutely. Well, thank you guys for watching, and stay tuned for our interview with Thomas Horton about telehealth so that you can learn more too, and let us know what you think about it and if you've tried it. We'll talk to you soon. Bye-bye.